And teens in plastic surgery, more young people are doing it. The procedures that they're requesting. Fox 5 Morning News starts right now.
Serving all of San Diego, this is your Fox 5 News.
As you know, more than ever, teens are faced with an unrealistic beauty standard, and board-certified plastic surgeon Dr. Vincent Marin and high school senior Jordan Austin are here with what parents and teens should consider before making alterations. Good morning to you both.
Good morning.
Doctor, let's start first with you. First of all, are you seeing more teens coming in? And if so, what sort of procedures are they wanting?
We're seeing more teens. It's not necessarily that kind of all of a sudden it's become so popular. We're seeing a lot of teens, but we are seeing more. A lot of teens will come in for nasal surgery. It's usually prompted by some breathing difficulties and things like that. And you do see patients even younger than teens, or if they have prominent ears, things like that, and they'll come in earlier, and sometimes even 6 or 7 years old.
Is there an age you have to be before you can get surgery?
Different procedures require kind of different age requirements as we go through. So for ears, patients, like I said, usually ear development's complete by 6 or 7. So you could operate on a patient, and we like to do that before they go into a grammar school scenario where they might get teased. So it's something you can do it at a transition in between elementary and grammar school. Noses usually around 14 or 15, and then any breast surgery will usually wait till the patient's at least 18 years of age.
Is that, you mentioned getting teased, is that a good reaction to getting teased?
No, it's we see a lot of patients that will suffer, and the issue is it's a balance here, and really we want the patient's family to be involved and kind of looking at the degree of deformity that a patient might have and whether this is a decision. It's not one to be taken lightly. So you really want to make sure that this one is a problem, the child's mature enough to handle surgery, and also try to assess what kind of psychological impact it might have if the patient is chronically ridiculed by, unfortunately, children that you know, can be difficult to others of the same age.
Yeah, they can be so cruel. All right, we were just looking at some pictures just a second ago. We'll look at them again. The first one is ears, and what's happened here?
Ears. This is just this is actually a little bit older patient. She's obviously you know, in her late teens, early 20s, but prominent ears, and it's something these patients usually just want it to go away. It's kind of a simple surgery. You tuck the ear back, and you're able to just make them look that they're not so prominent. You just kind of don't notice them, and that's all these patients really want. They're not looking for a huge cosmetic change. You don't come in requesting a specific, you know, I want to look like so-and-so. They just want this prominent ear to kind of just not be something that everyone notices.
Sure. And then the second picture that we have is a nose job that was done.
Yeah, patients, and a lot of times what prompts younger patients to come in is a breathing problem. Females usually are skeletally mature. You know, I mean, they can tolerate a surgery like this at age 14. Males a little bit older, 15, 16. And patients will come in, and usually if there is something cosmetic and you're working on an airway, it's a time to do it. You want to do the surgery kind of one time and do it right the first time.
Right.
So, but we really do want patients' families involved. Kids have to be mature. It's not something to take lightly.
Sure. And Jordan, you are a senior this year.
Yes.
Kind of talk about, if you would, sort of the pressure, especially in high school, to look beautiful.
I think the pressure mostly comes from like celebrities and things like that, and how skinny and beautiful they make them seem, and it's kind of their job to do that, but they make it seem like that's how you should look, and that's what's normal to look like. And also a lot of the shows you see or people you see with moms and sisters and things like that getting plastic surgery kind of makes you think that that's what you have to look like, and that there's only a few specific body types that you should be, you know. So there's kind of pressures from every angle, I think.
Do your sister, I guess, had a procedure done. Do you have other friends or other people in your life that you know that have had plastic surgery done at a young age?
At a young age, not any that I know of personally, but I know that there are definitely people who are thinking about it. They think that there's only specific ways to make you look beautiful, you know, and a lot of that either comes from that is just what makes them happy, or it's more along the lines of they just want to look like everyone else.
Right. And Doctor, we have a couple of pictures of, obviously, you're speaking of the celebrity standard that everybody's kind of holding themselves to. We have Miley Cyrus there, who a lot of people believe may have had a nose job, and also Ashley Tisdale. What do you think of that?
You know, I think they do set a tougher standard for some of the younger girls, and I think the key with this whole teens in plastic surgery is that it doesn't fix your problems, it doesn't change who you are, it doesn't make you a better person, but it can make patients feel more comfortable with themselves. And I think when you kind of put it in that angle, it's a valuable surgery that needs to be taken very seriously. It shouldn't be something that as a graduation present, you know, you get this surgery you've always wanted. And it does come, there's a lot of stress from Hollywood, both on the girls that are celebrities, and then that reflects its way down to high school girls and boys everywhere. They see this pressure. So it's important. Families should understand, parents should understand. I think it's something that deserves a long discussion over dinner before you embark on surgery.
Very good. Dr. Marin, thank you so much for being here. Jordan, thanks so much to you as well. And Marin Aesthetics is located in Del Mar. You can get more information on them on our website, fox5sandiego.com. Click that Scene On tab. All right, Raul, back over to you.